let's go over some of the most basic guidelines. And I can tell people, I pulled a lot of this information right out of the book, A Patient's Guide to Medicinal Cannabis. It's an excellent book. If people want to get their hands on it, you can learn a lot. So one of the things that I liked about it was they gave some general guidelines in micro dosing. They gave one called the standard dose and then a macro dose as well too. So I'm going to read this to you guys directly. So they say micro doses, this is anywhere from 0.5 milligrams all the way up to 20 milligrams of CBD. And they recommend that for sleep, headache, PTSD, generalized anxiety, and some of the metabolic disorders. So again, that's 0.5 milligrams all the way up to 20 milligrams for those general disorders or symptoms. Now, when we talk about standard doses, this would be an increase of 10 milligrams of CBD upwards to 100 milligrams of CBD a day. This tends to get more into the specifics of things. So they reference Lyme disease, they reference depression, they reference arthritis, fibromyalgia, multiple sclerosis, they reference IBS, Crohn's disease. So this really would start to fall into that category of maybe more autoimmune diseases, something that's a little more complex than just your day-to-day symptoms of insomnia, stress, things along those lines. And again, that would be anywhere from 10 to 100 milligrams a day. Now, I'll say this as a disclaimer too. In my practice, I have very few individuals who are using more than, I would say, 150 milligrams a day. So I'd say as we move forward, it's rare that you're going to see someone in the macro dosing level in most cases. Now, when they do reference macro dosages, this is from 50 milligrams a day upwards of 800 milligrams plus. So you're almost talking a full bottle a day of the 1,000 milligram CBD oil. So these are very high dosages. And this is more reserved for patients who may be suffering with a cancer, people who may be suffering from epilepsy or a major seizure disorder, life-threatening conditions, very severe, very advanced conditions. Most people that I work with, we use the 1,000 milligram bottle. That's probably the most popular one that we use here in my offices. And I usually start people at half a dropper in the day, so half a dropper in the morning, and then maybe half a dropper in the evening too, depending on the individual. Most people, I'm actually going to say it's a half dropper in the morning, half dropper in the evening. I don't know, 85% of people are going to do well with that and not develop the headache, not develop an issue. And then we say, okay, do that for 4 days. So then after 4 days, I'll say, how do you feel? Did you sleep better? Did you notice less hot flashes? Did you notice a change in the headaches? Whatever symptoms we were going after, we asked them about. If they say, no, but I also didn't notice anything negative, I say, okay, great. Then we're going to advance you. So this is day number 4. We say, okay, you were doing a half dropper and a half dropper. We're going to now have you do a full dropper in the morning and a half dropper in the evening. Let's see how you do with that. At that point, most people usually start to see some results. If they don't, we go another 4 days. And as long as they say, hey, I didn't see anything negative, I didn't see anything per se positive yet, then we'll usually jump them up to a full dropper in the morning, a full dropper in the evening. If that's too much at once, you can obviously split that up throughout the day in a different way. That's just our approach. It's simple. Most people understand it. And we use that pretty much across the board, no matter what the condition is or what we're dealing with. And that works. That works. Now, you mentioned earlier, what I find is, because for some people, my initial recommendation of half in the morning, half in the evening is too much for them. They'll usually report that they got a dull headache, and that just seems to be a telltale sign that I've seen over and over, where I actually experienced that the first time I used it. I didn't really understand a lot about it going back, 2-3 years ago. But nonetheless, if they do experience that, I tell them, great. You know what? That means it had an impact on your body. We know it's going to do something for you. We just started off with a little too much. So let's cut back. And then for that individual, we just go the opposite direction. Instead of increasing, we're decreasing. And usually somewhere along the path of either increasing or decreasing. And as I mentioned, we stay at a dose for about 4 days. We eventually find that quote unquote sweet spot. And it's just so different across the board. If you listen to our other podcasts, you might think someone who's bigger or has more body mass might require more. Well, that's not true, because if they're a female and they're in menopause, well, maybe they require more than a female who's tinier and not in menopause. So you really do have to experiment. The medications you take, the foods you eat, your lifestyle, it all plays a role. And then one of the biggest and trickiest parts to all this is that everyone metabolizes CBD differently. Your endocannabinoid system is different from mine, and it's different than someone else's. So the best example I could use that people could probably have heard a story about, why is it that if one person were to use a THC-containing product, they feel relaxed, and another person feels paranoid? Everyone's endocannabinoid system is different. CBD is no different, except we're lucky with CBD, you're probably not going to have those negative side effects that could potentially occur with THC. When we're talking about the CBD BioCare products, no. And you can go right and, again, look at the government patent. They put on there CBD does not have overdose potential. It does not have the addiction potential. So we don't have to worry about those two things that we have to worry about with a lot of medications that are used for pain and anxiety and depression. So that's great right off the bat. The most common side effect I've ever seen was just that dull headache. And even that's rare. And it's been a simple fix for us. We just cut back the dosage. That's the main thing I've seen. Maybe once or twice we had someone say it gave them a little stomach upset, but it's hard to predict. Maybe they ate something that day, but same deal. Okay, let's cut back the dosage a little bit and see if you feel better. So no, right off the bat with CBD, there does not appear at the time in the literature, according to the patents, to be any major side effects. And I think it's going to continue to go that route well into the future. Now, when it comes to medication interactions, and you'll see this on any website, you'll see this everywhere, they talk about, it interacts with this enzyme in your liver called CYP450. So let me just explain real briefly how we got to that conclusion that it interacts with that enzyme. So there was a trial done in 2014. GW Pharmaceuticals looked at their product, which they have a prescription CBD low-level THC spray. And they noticed that, hey, they prescribed the spray, and then they did a test with a drug that speeds up the activity of CYP450 liver enzyme and one that slows it down. And I'll tell you exactly what the study said, because it's important to understand this to an exact, because it's in defense of CBD and really how minimal the chances of these reactions are. So they did a systematic review in 2014, and they concluded that CBD generally has a low risk of clinically significant drug interactions. A few studies in current review included examination of drug interactions with CBD, specifically GW Pharmaceuticals, and their CBD THC spray. They used a CP450 inducer, a CP450 inhibitor, and this is what they concluded overall, that CBD in combination with these drugs are well tolerated, but consideration should be noted when co-administration with other drugs using this pathway is given. So they basically concluded this. In most cases, it's going to be safe, even when we're using drugs that would be considered to have severe interactions. Now, someone else brought up a great point actually earlier in the week on our forums, and they said, well, wait a second, what about taking it sublingually versus orally? Is sublingual going to have as much interaction as, say, a capsule or a food or an edible? And it turns out that was a fantastic question. No, when you take something orally, that supplement, that medication, whatever it is, it has to go through your lower GI tract, and then it goes right to your liver, where that metabolism of that supplement or drug occurs. When you take it sublingually under the tongue, like our droppers, it goes directly into your bloodstream. It doesn't go from your gut to your liver. It goes directly into circulation. And then once it's already been in circulation and been absorbed, some of the leftovers will then pass through the liver. So yeah, the chances are much less likely of having an issue with a sublingual than if you were to have, a mega dose of an oral serving or an edible or something along those lines. So I thought that was important to note.